Good evening, everyone. Welcome to Mindfulness and Mental Health presentation. Mindfulness is a practice of being aware of each moment as it arises and bringing an attitude of kindness and non-judgment. Both ancient wisdom and modern science have demonstrated its benefits. Meet Dr. Davila and learn more about the history and practice of mindfulness and how it can support our mental health. I would like to give you a small introduction about her. Dr. Davila is an adjunct instructor in the Family Medicine Department at Oakland University, William Beaumont School of Medicine. She is dedicated to providing compassionate care, empowering patients, and addressing the root causes of disease in a holistic manner. She practices with a focus on women's health, hormonal imbalances, digestive disorders, and autoimmune issues. Let's welcome Dr. Davila. Hello, Dr. Davila. Now everything is yours. I will hand it over to you. Our patrons are eagerly waiting to hear your presentation. Thank you. I will mute myself and also I'll go away from the video as well. Thanks.
Thank you so much, Uma. It's a pleasure to be here. I'm just so grateful to be able to join everybody and present on mindfulness. So let's see. And I will say before I start that there's a bit of a thunderstorm happening around where I am. So you may hear some thunder, but hopefully it won't change anything about our power and internet.
Yeah, here also I have a lot of thunders and hopefully nothing should happen to our power. There shouldn't be any power cut or anything.
Yeah, so what I had thought to do today, we have about an hour, and mindfulness is such a big topic, and it's also very experiential. So I will be giving a little bit of background just in terms of kind of the mental health crisis basically that we're facing right now in this country and worldwide. Just to kind of put everything in context, and we'll talk a little bit about what mindfulness is, and then I'd like to leave some time to be able to do a practice together, maybe like 10 or 15 minutes. And then I'm happy to take any questions or comments as well. So I will just jump right into it. I have a PowerPoint. Let's see. And I'm assuming you can see this. Let me know if not, but this is our department. So I'm at Beaumont Integrative Medicine. This is, we have a variety of different services at our department. So I'm a naturopathic doctor, but we have massage therapist, acupuncture, yoga therapy, nutrition, Reiki, which is a type of energy medicine, integrative physicians. So lots of different modalities working together to really support people's overall health and serve as a complement to the conventional approach of medicine. And if anyone was here last month when I spoke about lifestyle and integrative therapies for mental health, you'll notice some similarities. So this slide was there as well, but this is just to give some perspective on overall well-being. And this is just one perspective, so it's not the one and only, but I like to just show that mental health and overall health are very closely connected and also very multifactorial. So you can see with overall health, and this is individual health, there's these different aspects: our social connection, the conventional treatment that we receive, our sleep, the mind-body connection, supplements that we take, which aren't always necessary, but sometimes we take supplements as well, spirituality and connection, nutrition, exercise. And so these are all important for our overall health, and mental health is really in the middle of this because it's a foundation for our overall health and well-being. And the mindfulness that we'll talk about today could fall into, maybe multiple of these categories, but I'd kind of place it maybe in the mind-body connection aspect. So it's just to kind of say that, mindfulness is one aspect of how we can support our overall health. But, there are many others as well. And also to say that this is a focus on individual health in the green, but we also need to consider organizational health. So how is the health of the organizations that we work with, whether it's our place of employment or school or our faith community or whatever types of organizations we're a part of, the health of those is going to influence our individual health, and then the health of our society is also going to influence our individual health. A lot of our individual health can be determined just by our zip code and where we live, and different people have different opportunities and are exposed to different challenges, whether it's environmental pollution or racism or lack of access to different services. And so that's definitely going to influence individual health as well. So it's just to put it all in perspective. And then in terms of the pandemic impacts on mental health, I wanted to just, show some of these slides just to, like I said, put it in context and, possibly validate some people's experience. It's been just a huge, the COVID-19 pandemic has made a huge impact on overall mental health in the world. There's a few different surveys that are being noted here, but this one survey, it's called Stress in America, I'll show some slides in the following, but they estimated in the first year of the pandemic that global prevalence of anxiety and depression increased by 25%, which is very significant. Another survey by the Kaiser Family Foundation, or actually that first one was from the World Health Organization. The second couple are from Kaiser Family Foundation and University of Chicago, but the pandemic has negatively affected the mental health of at least over half of adults, and 42% of people in this survey reported feeling hopeless at least one day in the prior week. And then these are just some figures from this. The American Psychological Association does this survey. It's called Stress in America. And this one is from 2020. There's some from 2021 as well, but it surveys about 3,500 adults. And in this one, this was done in October 2020, about 1 in 5 adults say that their mental health is worse than this time last year. But I think it's interesting to look at the breakdown by generation. So, it's 1 in 5, but really for certain generations like Gen Z, which are people roughly between the ages of 10 and 25. But I guess for this, if they're looking at adults, it would be people between the ages of 18 and 25. It was really 34% of them felt that their mental health is worse than this time of year. And then it just, is so the young people are in a lot of ways, it's a big concern in terms of the younger generations and their mental health. This was from 2021, so I think this data was collected in August of 2021. So a lot of this is about stress. So the percent of people that have experienced behavior changes in the past month as a result of stress. Again, it's the Gen Z adults, 80% of them have experienced behavior changes in the last month as a result of stress. And then it kind of, goes down from there with millennials, Gen X, boomers, and older adults. And then parents are also more affected than non-parents. This specific marker here was really highlighted in a lot of the media coverage of this survey from 2021. So sometimes I am so stressed about the coronavirus pandemic that I struggle to even make basic decisions. So these are basic decisions like, what am I going to wear today? Or what am I going to eat? And so people are really struggling. Here it's the millennials that report the highest incidence of this type of stress, but you can see it's, the Gen Z millennials and Gen Xers that are really suffering here. And then this looks at different racial groups. So average stress level in the past month. And so you can see people of color, Hispanic, Black, Asian, are more affected than non-Hispanic white adults. So it's really a lot of the younger generations, people of color, that seem to be the most affected in these surveys. And then this was from 2020, but I think it's important to note that despite all of these, Americans do remain hopeful. So despite all of these stressors, around 7 out of 10 Americans say that they feel hopeful about the future, and it's about equally split up among the generations. So, there is hope, and I think that's great. So we talked a lot about stress here, and I just always like to talk a little bit about the stress response system, because there, I think, tends to be a little bit of a a view that stress is something that's, just happening in the mind or the emotions, and that it doesn't necessarily have any measurable physical effects, but it definitely does. So this shows how stress, it really starts in the brain. We perceive a stressor in our environment, and that gets filtered through the brain. The brain sends chemicals down to, first, the adrenal glands, which are 2 little glands sitting on top of our kidneys, and they release hormones, adrenaline, which is also called epinephrine and norepinephrine, and then cortisol, which is another longer-term stress hormone. And then those hormones go to all the different, places in the body, the different organ systems, and affect them. Really, we're mounting, this system is the same one that is recruited if we are running from a threat, or if we were being chased by an animal. The same system is activated there, as well as if we are having stress at work or in our relationships. And so the body is going to respond in a similar way. It's going to increase the capacity of the lungs to exchange oxygen and gases, to give all of our muscles and our heart oxygen and nutrients. It's going to increase the heart rate to move blood and oxygen around the body. The liver is going to create glucose, which can be used as a fuel for our muscles and our brain in times of stress. And so blood sugar is going to increase. And then blood pressure also increases to help pump the blood more effectively. And then the digestive system actually decreases, because we're really trying to put all of the resources to the systems that are most needed in this time of threat. And so these are just some of the things that happen from a physiological standpoint. And I think, from a real world context, a few different scientists and educators like to use this loop, which can be used for showing how we get into habits, but it can also be used to show how we react to stressors and how this can become kind of a cycle. So this kind of puts it into a little bit more of a real world context. This is, I'm taking this from Judd Brewer, who is a psychiatrist that does a lot of this work. So just to kind of, bring it into the real world. So we experience a stressor. So, a variety of different stressors that could be there. I just put up a few. It could be deadlines related to work or school, financial insecurity, pain, physical pain, or health issues, loss and grief. It can also be worldwide issues, war, the pandemic, systemic inequalities, climate change. And so these are stressors that are coming in that are external. Some of them are internal, pain and physical symptoms are internal as well, but all of these are processed through that same system that I just showed. And then we experience activation. So everybody, experiences this a little bit differently, but there are a lot of similarities. So, think about how you feel, recalling a stressful event and how you feel. Heart rate increases, blood pressure increases, there's sweating, muscle tension. Sometimes people feel tightness in their chest, and there can be thoughts and emotions that go along with it as well. Fear, worry, anger, sadness, regret, just to name a few. And then this, we want to feel better. So, a lot of times as it's just our body is trying to protect itself and trying to get us out of pain and danger. And so we do things to try to make ourselves feel better in the moment. And there are other things that could be there, but these are just some of the more common ones that can lead to maladaptive behavior. So we could become very busy, busy all the time as a way to kind of distract ourselves. Overworking, kind of another way to distract ourselves. Eating and substance use could be ways to sort of feel better in the moment. And they do help us bring us back to baseline. So they are serving us in that way. Yet in the long term, these can become maladaptive coping behaviors, things like dependency on substances, or over time we can become, depressed, burned out, or there could be chronic pain, sleep disorders, chronic illness. And so these same behaviors, the hyperactivity, overworking, etc., that we did to kind of make us feel good in the moment, in the long term, those actually feed back, and they're a stressor of themselves. And so they're a stressor in themselves. So that's why this is, kind of a loop like that, because the actual behaviors themselves become stressors and then just perpetuate the cycle. And so could there be something that could kind of intercept this cycle, that could either stop, the activation from the stressor to the activation and kind of help to attenuate that a little bit so that the activation isn't quite as strong and distressing to us? Could there also be something that could intercept or, mediate in between the activation and the reaction, so that even though we become activated, we don't, we're able to kind of pause and we don't necessarily have to react in that way, to kind of get us out of this loop of reactivity and really stress reactivity. A lot of it is not conscious. It's something that we really do. It's happened so quickly, and we don't really know that it's happening. So we'll talk about mindfulness today. So, intercepting in these kind of blue wave-looking pictures that I put in there. There are a variety of different techniques and therapies that can help to intercept this response, and a lot of them are the mind-body therapies. So things like yoga, meditation, guided imagery, Tai Chi, psychotherapy can do this. And mindfulness is one of them as well. So there are a variety of different biofeedback. So there are a variety of different tools that can be used in different traditions that can be used there, but we'll talk about mindfulness today. So I guess in terms of, mindfulness, probably most of you have heard about it by now. I think there's a lot that can be said about it. I think people really can relate to, something like this picture where there's, the person and the dog are going for a walk, and the person is walking yet thinking of everything on their to-do list, or a disagreement that happened earlier, or something that might happen later, or fantasizing. And so they're, really the mind is not in the present moment, whereas the dog is, walking and is in the present moment. So I think a lot of people can kind of, relate to this idea of feeling somewhat disconnected from their day-to-day experience. How many of you have walked into a room and come into the room and realize, you don't remember why you came into the room in the first place. Or, even driving to a familiar place and arriving there and realizing that you don't really remember what happened in the drive or what the drive was like. All of a sudden you're there and you don't remember any of the details of the drive. So these are ways that we can be in this autopilot and this, these habits throughout the day. Also, we could be in a conversation and realize that we had no idea what the person just said. We were, maybe thinking about what we were going to say next, or thinking about, the past or the future, or, what I'm going to do after this conversation. And so, little different than the mind being an autopilot, but it's that the mind is not in the present moment. So very common. I think a lot of people can really identify with this. And but the practice of being present and mindful is very simple. So, I can't see any of you, but, a lot of times I'll say, raise your hand, but just kind of tune into your body and notice if you can feel your feet sitting on the floor or wherever they're resting. Can you feel your feet? So you're aware that you can feel your feet, and that's, an intentional awareness and an experience of the present moment. Or what about, are you able to feel the weight of the body sitting in the chair or standing on the ground, wherever you're standing? Can you feel that? That's another way to connect to the present moment. Or feeling the breath moving in and out as you breathe. So not needing to change the breath, but just can you notice how it feels as the breath moves in and out of the lungs? So these are really simple practices. And I'll say too that even if you can't feel your feet or you can't feel your hands, and you know that, that's also mindfulness, because you know that you're not feeling something. And so you're aware of what is happening in that moment. So we have this opportunity and this choice to do this, every moment of the day, really. And so anytime that we connect our intention and our attention to the present moment, that is, in doing so with an attitude of kindness, that's mindfulness. And so we can connect to all of the five senses. So the sensation of touch, feeling how the feet feel or the body feels sitting here, or how does the breath feel moving in and out. So that's connecting to the sense of touch, but we can also connect to the sense of sight. So what are we seeing in the environment right now? The sense of sound, what do we hear? That's another way to connect to the present moment. And then, there's also smell. Do we smell anything right now in the environment? Or taste, are there any tastes in the mouth right now? And so connecting to any of those is a way to intentionally practice mindfulness. And so we use the body a lot in mindfulness as a way to connect ourselves to the present moment. So let's see. I think so. In terms of just a little bit more about the history of mindfulness and the background of mindfulness, I'll just put a couple more slides in before I'll invite you into practice with me. But so mindfulness is, like we kind of talked about, it has these sort of three qualities, which is the three bullet points that are there first. So paying attention to the present moment. So whether it's, what we're feeling, what we're seeing, what we're hearing, we can also do it with our thoughts and our emotions. So what are we thinking and what are we feeling? Those are feeling in terms of, what emotions are we feeling? Those are a little more challenging. And so, we invite that as an experience, but a lot of times we'll start with the physical body because it tends to be a little bit easier to stay present with the physical sensation. So it's paying attention to the present moment. It's also doing it on purpose. So with this intention, and then in a particular way. Like I said, we're doing this with kindness, with curiosity, without judging, and knowing that we will have judgments about things. I like this, I don't like that. This feels good, this doesn't feel good. So it's normal to have those judgments, but it's really inviting this kind of acknowledgement and acceptance of what is happening in the present moment without thinking that it should be some other way. Mindfulness is also based in Buddhist principles. So it kind of seems like it's a new thing, but it's been around, for at least 2,500 years, if not longer, most likely longer. And there are a variety of different cultures and traditions around the world that have written and practiced this concept of mindfulness, although they might use different words for it. But the way that mindfulness is mostly practiced in modern society is drawn mostly from Buddhism, the teachings of the Buddha, who lived in what is now Nepal and India about 2,500 years ago. That said, you don't need to be Buddhist or have any sort of religious beliefs in order to practice it, and it does not interact with any other religious beliefs or faith. Mindfulness is also an inherent human capacity. So it's this capacity that we all have. A lot of times we think it's something that we're trying to get and that we're trying to achieve, but it's there already, and we just kind of need to be there for it and notice. And like I said, it's experiential. So we'll stop talking soon and lecturing and experience a little bit. There's a lot of research about mindfulness, and it's an exciting field. It's also a new field, so I think it's important not to get too excited about it or overstate the research. But a growing body of research is showing that mindfulness can help with a variety of different aspects of our mental health. So our attention, emotional regulation, self-awareness, and then also a lot of this has to do with stress and how we relate to stressors and difficulty in our lives. And so it helps us, it can help to improve stress resilience and decrease reactivity to stress. And then there are a lot of different health conditions that it's been shown to be beneficial for, but the three main ones are anxiety and depression, as well as chronic pain and prevention and treatment of addiction. And those three are really very much related as well. And then this little picture on the right just shows, in terms of some of the mechanisms by which we think mindfulness works, all of the red shaded areas are the places in the body where mindfulness practice has been shown to downregulate those areas, and those are mostly our stress reactivity pathways. And then the blue area is where mindfulness practice has been shown to increase function in those areas. And so that's mostly what's known in the brain as the prefrontal cortex, which is really the executive functioning aspect of the brain, how we make decisions and plan and regulate our emotions and thoughts. And so it's kind of this higher level, kind of a little bit more, logical versus reactive. And this is just to show that this only even goes to 2016. So at this point, it's 6 years ago, but it's just to show the exponential increase in research related to mindfulness. A lot of this is because there was a program called mindfulness-based stress reduction that was it's still around. It's been offered for now over 40 years. It started in 1979 at the University of Massachusetts Medical School, developed by John Kabat-Zinn, and now it's taught at over 700 different institutions worldwide. And so most of the research is based on this program. So that's why it kind of started out in the early 80s and then it has been increasing exponentially since then. And I think there's a lot of misconceptions. I think because mindfulness has become a bit of a buzzword, and it's
Hello,
probably
you have frozen.
oh,
Oh, okay.
am I
Now I think, yeah,
did I
now it is
unfreeze?
okay. Yeah,
Thank
yeah.
you.
Now I think it is okay. Yeah, for some
Okay,
minute.
perfect.
Okay.
Good. Yeah, thank you. Just let me know if that happens again. I appreciate it. Um, Yeah, so I think because mindfulness is becoming so well known, there are some misconceptions about it. So it's just to say that it's not having a blank mind or trying to block thoughts or push them away or reach some particular state. So it's not as though we're trying to be relaxed or peaceful. That might happen at times, but it's not the goal of mindfulness. And sometimes, with mindfulness, really we're trying to sort of establish methods of being present with our life, whatever is happening, whether it's something joyful or something painful. And so sometimes it is, it can be difficult and it can be frustrating. It's also not about being emotionless or, withdrawing from life or being complacent or apathetic. It's really more about how do we what is called for in this moment, and knowing the answer to that. How do we respond to a given situation? And sometimes that's going to involve taking action. It's also not being happy all the time either. So again, it's, being present for all of the moments of our lives. And like I said, it's not a cure-all. Even in, that first slide, it's just one aspect of our overall health and our mental health, but it's an exciting field, yet it's just compared to a lot of fields, it's just a baby. And then there are risks to it. With, a brief practice like what we'll do today, not a lot of risks, but I do recommend practicing with a qualified teacher, and the research shows that working with a qualified teacher in a group class is where most of the benefits are, likely to be found. You're kind of giving yourself the best chance to experience the benefits in that way. And then the teacher can also help to mitigate any risk. So for example, some people that have anxiety or a panic disorder, focusing on body sensations like breath can sometimes be activating or triggering. For somebody with a history of trauma, sitting with the thoughts and the emotions can also be, very activating and dysregulating at times. And so it's important to take care of yourself. And, I would recommend working with a teacher if you're going to explore it in any detail. And then, it's not linear. So each day that we practice is going to be a different day, and it's a different moment. And sometimes it will be a moment of ease and kind of relaxation. Other times it might be the mind completely active and the body tense, and we feel, frustrated. But both of those there's one of those isn't better than the other. So they're both practices, and they're both helpful. So we learn from both. And like I said, it's not a religion either. So let's see. I'm going to stop the share, I guess. Let's see here. Okay, good. So I think, it'd be nice if we could practice it a little bit, and then we'll talk a little bit about, at the end, some resources and things like that for people. But if you would like to join me in a practice, I would invite you to find a position that you'd like to maybe sit in for maybe 10 minutes or so. I think that's probably what we'll do, 10, 15 minutes. Just so I'm seated in a chair. That's, typically the way that it's done. You're welcome to do it standing or lying down. You're also welcome to take, some movement. We've been sitting here for a little while now, and you might have been sitting all day. So if there's any movement you want to do, even, rolling your shoulders or, moving your arms around or, standing up and walking around, do that as well. Tuning into what the body might like. and noticing how it feels to move the body. So a lot of times doing a little movement before you sit can kind of help you become more in tune to some of the sensations in the body. And then when you're ready, just settling into a posture, but also knowing that as we practice, you're welcome to shift or move, so you don't have to stay motionless. You're welcome to stand up, move around, stop the practice, as well as, if you close your eyes, you're welcome to open your eyes at any point. But so settling into whichever posture you're going to choose. If you'd like to allow the eyes to close, if that's comfortable for you, please do. Otherwise, I would suggest maybe maintaining a soft downward gaze, or just kind of focusing on maybe one object in the visual field. This helps to quiet the mind a little bit. And just sitting here feeling the weight of the body supported and held by the chair and the floor and the earth below that. The spine is upright, lifting through the crown of your head if you're standing or sitting. What's this balance between kind of a grounding and an uplifting? Just kind of checking in with the body right now, so not needing to figure anything out or fix anything, but just noticing what's here. So what's the general state? The body, any sensations that are there, any pain or tension, any places that could soften. What about the mind? What's predominant in the thoughts? Are they very active? This might be really the first time that you've stopped all day, so just allowing some space. If the mind is active, just noticing that, letting it be. And any emotions that are there, making space for those too. And then sensing into the contact points that the body's making. So the seat against the chair, and the feet against the floor, wherever they're resting. The hands, wherever they're resting. And then the invitation is to allow the attention to rest with an anchor. So an anchor is just something that you can use to stay connected to the present moment. So it helps you to know that you're present in here. The most common one is the breath. And so if you're going to use the breath as your anchor, you just notice wherever the breath is most vividly felt for you. So it might be the abdomen rising and falling, or the chest expanding and contracting. Could be the air moving in and out of the nostrils. No need to change the breath. You're just noticing how it feels. And if the mind wanders, that's normal, that's all right. If you notice that you're lost in a train of thought, you just gently and kindly invite the attention back to rest with the breath and begin again. And so the breath, as I said, is not always a comfortable anchor for everybody. So if you'd like to try a different anchor, I would suggest an option could be the feet. So kind of sensing into the feet, not thinking so much about them, but more feeling what there is to be known with the feet. Is there pressure, tingling? Could also use sensations like this in the hands. Another option for an anchor would be sounds. What sounds do you hear in the environment? Sounds coming and going, not needing to label them or know where they're coming from, but just noticing the sound for what it is, the tone and the pitch. So those are some other options for anchors. And so deciding on one for this practice, we'll rest for several minutes with that anchor. So one is not better than the other. It just depends on really whichever one felt comfortable and accessible to you and neutral. So the breath, the feet, the hands, or sounds. And you're welcome to use another anchor as well if you have one that you've used before. So just letting your attention rest with that anchor. Observing the sensations there. Not needing to block any thoughts or emotions or other sensations in the body, any sounds that you hear, they can all be there. They can come and go, move through the awareness. And there's still this light connection with your anchor, this place of stability and grounding. And when you do notice that you've been lost in a train of thought, so you notice that the attention has gone somewhere else, thinking about the past or the future, some story or fantasizing. So when you notice that, that's mindfulness. That's a moment of mindfulness, a moment of waking up and remembering the present moment. And so again, bringing some kindness, some curiosity, and inviting the attention again to rest with the anchor. Noticing what's most predominant in the awareness now. Sometimes we think it should be something else, but it's just information for us, noticing where the mind goes, noticing what's here. And then as we come to the end of the practice, sensing in again to the contact points that the body's making. So the weight of the body, sitting if you're sitting, the feet on the ground or wherever they're touching, the hands. Checking in again with the body, the mind, the heart, what's here now. The possibility of just allowing whatever is here to arise and be known. And then as you're ready, gently opening the eyes if they were closed. And then taking in the world around you. So I would suggest looking beyond the screen. Be looking to your right and left, up and down. Just noticing what you see, what you hear. And then when you're ready, reconnecting with the group. So thank you everybody for practicing with me. That was about 10, 12 minutes or so.
It was awesome, Dr. Davila. Okay, there is a question also. Now, are you done with the presentation? Can we take questions or is still
questions
there?
Would be great. Yeah, so basically, I'll have some resources to share at the end if people have questions about, how to practice or learn more. I saw a chat question there, which I'm happy to answer. I'm also happy to know if anybody wants to share anything that they noticed in the practice or, any challenges that they had or surprises. I'm happy to hear any comments as well. But
yeah, I will also unmute if they want to talk, and I can unmute them and they can talk to you, or they can post their questions in the chat box. There is one question here. How is mindfulness different from meditation?
Yeah, that's a great question. So, so mindfulness, really, to give a little bit more of a historical context, the word mindfulness is thought to be a translation of the word sati from the Pali language, which is an ancient language in India. And it's really this particular quality of remembering to be present and to do so with an attitude of kindness and curiosity. So it's this particular way of really relating to our lives and our experience. And so sometimes that's done through a practice of meditation. Meditation usually refers to an intentional practice that we're doing, whether it's a seated practice. Sometimes we'll do a walking meditation. Sometimes we'll do like a movement meditation, where we're really directing our attention specifically to that. So there are a lot of different ways to practice mindfulness, but then meditation is kind of like a general term. So there are many different types of meditation besides mindfulness. Mindfulness is just one type, but there's others like for example, transcendental meditation is a type of meditation that focuses more on a phrase or a mantra, and so kind of repeating that phrase. There can also be like guided imagery, which could sort of be considered a meditation as well. But I would say mindfulness is a type of meditation, but it can also be practiced in our day-to-day life. So it's something, that can be practiced when you are preparing coffee or walking to get the mail or in a conversation as well. And so those are some of the informal ways to practice it as well.
There is another question, Dr. Davila. When somebody verbally ambushes you, and how do you train yourself beforehand to better react to it so you don't wear it for days? Any resources?
Yeah. Yeah, that's a great question as well. I'd say that, the way I kind of presented it today, because it's like an hour presentation and we're just going to do a brief practice, it kind of makes it seem like, oh, it's really easy. We just do this and now everything's better. But I'll say, the way that we react, these are patterns that have developed in our brain and our nervous system and in our body over years, their behaviors. And so it takes time to change those behaviors and, as you say, kind of train yourself so that you don't react quite as much. I could actually, to answer this, I could maybe briefly show, a way that some slides where sort of an idea or a theory of how mindfulness might mediate some of this. But I'll just say that these practices that, I'm introducing today are really have the potential to do that, but the research that shows that these are beneficial is done usually over an 8-week period of people practicing for like 45 to 60 minutes per day, and then joining a group class for 2.5 hours per week. So that's a mindfulness-based stress reduction, and I'm happy to give you some resources there. But I would recommend maybe considering doing that as a starting point. But these are some of the practices that you could kind of have in your toolbox as ways to remind yourself on a day-to-day basis. So what we did today was, it's called focused attention, and it's basically it's almost like training the attention to be focused on a particular point, like this anchor that we used. This is a practice we'll a lot of times call it stop, and the stop practice is something that you could incorporate throughout your day. Just this stopping, pausing, taking a breath, and then observing what is going on in the body. It's basically the practice that we did today, but just, you could do this within just a few seconds. Stop, take a breath, observe what's going on in the body. So you could notice physical sensations. You could notice your breath, how that feels. You could notice the heart beating, for example. You could also notice what thoughts and emotions are arising. So you're really just kind of checking in with the body, and then proceed. So how do I want to proceed? And so this is, something that could happen over several minutes, and it's like a practice that we're doing, sort of like how we did today, or it could be something that you do in just seconds. An even shorter version of this is, a lot of times we'll call it 2 feet, 1 breath. And so let's say you're standing somewhere, and you could even do this like in line at the grocery store, or this was developed for healthcare workers that are kind of like moving from room to room and, seeing different people throughout the day. So each time you go into a new room, or if you were in this situation with an argument, you just pause and notice your 2 feet on the ground, and just again sensing into what it feels like to have having the feet in contact with the earth and what sensations that you're noticing, just noticing that your feet are on the ground, and then taking 1 breath. So it's a really brief pause, and practiced over and over again. There are a variety of different practices. It's not just the 2 feet, 1 breath, but these practices have been shown to decrease the stress reactivity. But really, a lot of it is just bringing this awareness and this mindfulness. And I guess, I'll share this quote too from Jon Kabat-Zinn, who is the one who developed this mindfulness-based stress reduction. He says, "The first and most important step in breaking free from a lifetime of stress reactivity is to be aware of what is actually happening while it is happening." So it's really bringing this awareness. And then these are the mindfulness-based stress reduction that I talked about. That's the program where most of the research is based on. And then there's also another one that was developed for people with a diagnosis of depression that's called mindfulness-based cognitive therapy. But the Beaumont Center for Mindfulness has this offers this class. There's a variety of different places around the world, but I would recommend one of the places where they're doing most of the education and research is at Brown University, and they have a mindfulness center there, and they do pretty much, I'm pretty sure they're doing all of their classes still by Zoom. And then there's also a global mindfulness collaborative that is through Brown University. So those would all be great resources. And then I put some others down there that aren't mindfulness-based stress reduction, but they're just other groups that practice mindfulness as well.
Okay, one small request, Dr. Davila, if you could email those resources, then I will email to all our participants.
Perfect.
Okay.
Yeah, I'll send it to you as a PDF because then it has the links within there, so that then they can just click on it. It'll take them right to the program website.
Okay, this is a question from my side. Every day morning I do like prayers, like our religious prayers. Does it mean like a mindfulness? Does it count as mindfulness or meditation? How do you say that?
Yeah.
Every day morning I sit and pray, chant some prayers, Mm-hmm.
Yep. So it definitely could be. It kind of just depends on the, intention and the attitude that you're bringing to it. So it's kind of, think of these three qualities. There's the intention, you're doing this on purpose. There's attention, are you aware of the present moment while it's happening? So as you're, speaking the prayer, are you aware that that's what you're doing? Or is your mind, you're saying the prayer, but you're actually thinking about something else. So that being aware of the present moment, and then doing it with an attitude of kindness, curiosity, non-judgment. So yeah, if you were practicing it in that way, it would be a form of mindfulness. And so really anything can be practiced. It's, a lot of times people will ask, like, how many, minutes or hours per day do you practice? And one of the, main teachers is a Vietnamese Buddhist monk, Thich Nhat Hanh, who recently passed. But he said, I practice 24 hours a day, 7 days a week. So, it's possible to bring this attitude and this quality to anything that we're doing.
Yeah, that's okay. Thank you. Anybody has any questions? I'm taking one more time. I don't see any questions other than these two. And thank you very much, Dr. Davila, for having, we really enjoyed your presentation. It was very good and also very informative and helpful. The meditation part, what you made us to do with you, it really gave me, I also sat in my chair and I did practice with you, and it really gave me good feeling. I know how to express that, but it's a good feeling to do that. Thank you. I hope all of our participants also have enjoyed it. Thanks again. We will see you again, participants. We have another program next month, that is April 27th, acupuncture and mental health. It's by Daniel, I think, from Beaumont Hospital. And please go to our library's event calendar and register for that event. Thank you.
Yeah, thank you
Have
so
a good
much,
night.
Uma.
Stay
and
safe.
Thank you, everybody, for coming and the great questions. Yep, it was my pleasure.